Good day, everyone. Today we are going to discuss on what is hospital administration. So in our topic, we will be able to identify the role of hospital in the healthcare institution. Our objectives are define hospital administration, describe the role of healthcare professionals in the delivery of healthcare services, discuss how the hospital industry differs from other industries, discuss the service characteristics of a hospital, discuss the classification of hospitals according to objectives, ownership, and level of care, enumerate hospital services, and define SWOT. Patient care is essential purpose of any healthcare organization. Excellent care to each and every patient is often stated as the hospital's main objectives. So the hospitals provide care in a variety of inpatient and outpatient settings using their own strength to meet patient needs. Many hospitals now expand their mission to sustaining population health, a substantially broader mission seeking the World Health Organization's goal, which is a state of complete physical and social well-being and not merely the absence of disease or infirmity. So what is hospital or what is the role of hospital as healthcare institution? Some health issues require escalated medical treatment and individual consideration which is not available in the patient's home or a medical clinic, like surgery or admission to the hospital or admission to the intensive care unit, which requires hospitalization. And this is conceivable only in a hospital where an enormous number of medical experts applying their knowledge and skills with the help of cutting-edge facilities. The World Health Organization defined hospital as an integral part of a social and medical organization, the function of which is to provide community quality health care, whether preventive, curative, or palliative. So the population health includes excellence in care to individual patients, including preventive care, fulfillment of needs that go beyond care, like housing, food, and social support that is essential to sustaining health and managing chronic diseases, and meeting the needs of people who are not patients to help them stay well and avoid becoming future patients. So, what is hospital administration? Hospital administration is the term used to denote the entire operation of the hospital as a business. The administration is composed of medical and health service managers. So, administrations range in size, and the duties of the administrator vary with the size and complexity of the hospital. The hospital administration incorporates services and products dedicated to improving the health of individuals, which includes healthcare equipment, medical services, pharmaceuticals, biotechnology, and research. So high-performing healthcare systems are critical to addressing key health challenges faced by hospital administrators. The delivery of modern healthcare depends on the expanding group of competent professionals working as interdisciplinary team. So today, the hospital is the place for the diagnosis and treatment of human illnesses and the restoration of health and well-being. The basic function of the hospital is to give treatment to the injured and sick without having any social, financial, and racial discrimination. And some other significant functions and services of modern hospitals are preparing healthcare professionals, uphold clinical research, and help all activities provided by the government and other non government organizations to prevent diseases. So, how does the hospital differ from other industries? First, defining and measuring output is difficult. The output is difficult because each case is unique and it depends on the health condition of the patient. Second, the work involved is felt to be more highly variable and complex than in other organizations. The hospital is composed of wide variety of specializations and professions which makes it more complicated than in other organizations. Third, much of the work is of an urgent and non-deferrable nature. It is because the hospital deals with a person's life, then urgency is of utmost importance. Fourth, the work permits little tolerance for ambiguity or error. So there is no room for error because one slight mistake can put a person or the patient in danger. Lastly, the work involves an extremely high degree of specialization. The hospital is composed of professionals with high degree of specializations like medicine, radiologic technology, nursing care, physical therapy, hospital management, and others. The hospital industry. The hospital as a service industry is entitled to provide patients with quality health care. Therefore, a hospital has the following characteristics. First, intangibility. Health services are highly intangible, which implies it cannot be tested or examined before consumption. The intangibility factor can be compensated by physical evidence like the place, people, communication, and price that patients can see. A hospital with clean and neat corridors, good customer service, advanced medical equipment, and competent healthcare professionals play an important role in a patient's preference. Second, variability. Health services are subject to a degree of variability. There are variations in services performance offered by the provider's employees depending on skills, customer service, and others, as the service offered by the hospitals is highly judgmental and individualized. So the variations in service also depend on the affordability of the patient and the reputation of the hospital. Lastly, quality of healthcare services. Verbal exchange is the best publicity, and it assumes an important function in setting the foundation of ascertaining service quality. So patients who are happy with a service delivered by the hospital can bring several patients to that hospital than advertising. Personal health services. Personal health services are the services provided by hospitals, health centers, and nursing homes, apart from privately practicing physicians. The care provided has been traditionally classified into the promotion of health, prevention of disease, early diagnosis and treatments, and rehabilitation. Promotion of health. Good well-being practices promote health through adequate nourishment, exercise, rest, personal cleanliness, well-being screening, and education. Healthcare professionals are concerned with the advancement of health. The healthcare professionals and the patients work together to to successfully advance health as well as illness care. Prevention of diseases. Primary prevention is an assistance to ensure against specific infections through vaccinations, use of specific supplements, and protection against work hazards and accidents. All diagnostic and therapeutic activity has the preventive component in that it seeks to prevent further deterioration of a patient's health. So, health screening, yearly clinical assessments, and monitoring of the patient with susceptibility to specific diseases fall under secondary prevention. So, it is sensible to expect that by preventing infection to the extent possible, the number of patients looking clinical consideration can be decreased and subsequently control overall health care costs. Early diagnosis and treatment. The earlier a disease is diagnosed and treated, the better the prognosis. The earlier the disease is diagnosed is better than cure. So the standard of early detection and treatment of cases in the general population is the premise on which infection control is built. A good deal of early diagnosis comes through the hospital-based screening and periodical clinical consultation among healthy people. Diagnostic and treatment services can be made available through ambulatory outpatient or inpatient hospital care. So the idea of a place for clinical treatments consolidates health centers, well-being support organizations, home care services, and hospital. Rehabilitation. World Health Organization defines rehabilitation as the combination and coordinated use of medical, social, educational, and vocational measures for training or retraining the individual to the highest possible level of functional ability. Apart from the restoration of functions, rehabilitation medicine involves disciplines such as physical medicine, occupational therapy, speech therapy, education, and vocational guidance. Rehabilitation thus must start early in the process of medical treatment. The classification of hospitals. So hospitals are classified according to objectives, ownership, bed capacity, and level of care. According to objectives, Teaching Cum Research Hospital. These hospitals are teaching-based and healthcare is their secondary objective. The college is attached for medical, nursing, or pharmacy education. They are engaged in promoting research activities and training for medical students. The medical colleges are attached to these hospitals. For example, the Davao Medical School Foundation Hospital. It was established in 1976 in response to the recognition of the lack of doctors serving rural communities and lack of specialists in urban centers of Mindanao. Its College of Medicine was the first college to be set up in Mindanao. The Davao Doctors Hospital. The Davao Doctors Hospital is a privately owned hospital founded in 1969 to address the increasing demand for nurses in Davao Doctors Hospital. The Davao Doctors Hospital School of Nursing, now known as Davao Doctors College, was established in 1975. Other examples are the Brokenshire Hospital, in which the Brokenshire colleges are attached, the San Pedro Hospital, in which the San Pedro College is also attached.